Good morning, Chairman Arrington, Ranking Member Boyle, members of the committee. Thank you for the opportunity to testify today. On behalf of Families USA, a leading national, nonpartisan voice for healthcare consumers working to ensure the best health and healthcare are equally accessible and affordable to all, I want to thank you for this critical discussion. No American should have to choose between going to see their doctor and buying groceries to feed their family. Yet almost half of all Americans can't get needed medical care because of the cost. A third say that the cost of care prevents them from securing basic needs like food and housing, and 40% of Americans face medical debt. As a nation, we spend more than $4 trillion per year on healthcare, yet the health of our nation's families is suffering. Since 1960, total national spending on healthcare as a percentage of GDP increased from 5% to more than 17%, and is projected to increase to 20%, or $7.2 trillion by 2031. Healthcare now accounts for almost 1/5 of our nation's economy, yet we have some of the worst health outcomes, lowest levels of access to care, and greatest inequities compared with peer countries. And nearly 250,000 people a year are killed by the healthcare system from medical errors, infections, and the like. Simply put, our healthcare system has lost its way. Our unaffordable healthcare spending is primarily driven by high and rising healthcare prices. We pay more than anywhere else in the world for prescription drugs, hospital stays, specialty care, MRIs, CAT scans, births, and time in the intensive care unit. These higher prices result in nearly $240 billion in waste annually to the healthcare system. Our nation's high healthcare prices and abysmal health outcomes are the result of broken financial incentives that reward building local monopolies and price gouging instead of rewarding successes and promoting the health, well-being, and financial security of families. Healthcare industry consolidation has eliminated competition and allowed monopolistic pricing to push our nation's families to the brink of financial ruin. Nowhere is this clearer than looking at the price of drugs and hospital care, which together account for 40% of our nation's healthcare spending. For more than a decade, drug prices increased 20% per year, far exceeding inflation. Since 2015, hospital prices increased 31% nationally, accounting for 1/3 of U.S. healthcare spending, growing more than 4 times faster than workers' paychecks. These higher prices are passed on to families as annual increases in insurance premiums and cost sharing, and become profit margins for large healthcare corporations. As a result, we cannot afford to retire when we want, buy a home, send our kids to college, or even meet basic needs like paying for food or rent. This excessive spending has created an economic crisis for the federal government, state governments, and taxpayers, limiting our ability as a nation to educate our children, protect our neighborhoods, care for our elderly, and build critical infrastructure like bridges and roads. But it doesn't have to be this way. We know what's driving the crisis and how to fix it. Solutions can be deployed right away to address the root causes of our nation's affordability crisis by ending these pricing abuses and restoring competition in healthcare. This committee is responsible for advancing budget priorities that reflect the values of families across the country and that invest in our country's future, build a strong economy, and protect and improve healthcare and other vital services for America's families. There is a bipartisan pathway to generate budget savings without undermining the promises to seniors, veterans, moms and babies, and people with disabilities. We urge this committee to consider well-vetted bipartisan solutions to increase transparency on prices, healthcare quality, and ownership data, to address hospital billing practices and payment differentials that drive consolidation and increase costs, to limit anti-competitive behavior in contracts, and to strengthen FTC and DOJ enforcement of anti-competitive practices. I'd like to finish my remarks with the story of Ben Lose and his 5-year-old son from Colorado Springs to illustrate the impact of unchecked corporate healthcare greed on our nation's families. In 2022, Ben and his wife rushed their son to the doctor after he began experiencing seizures. They were referred to a specialist in their network who ordered an EEG scan and assured them that the scan was covered by their insurance. 2 months later, the Lose family received a bill for $2,500. When they called the hospital to ask about the bill, they were told it was a facility fee, that the physician service was covered, but now they had to actually pay the hospital. Ben elevated the issue to the hospital administration leadership and was able to negotiate a reduction to his bill because it was classified as charity care. Frustrated by this experience, Ben investigated the hospital, but found it nearly impossible to determine who actually owned it. It was a giant black box. When he finally discovered the owner, he found that this particular system raked in billions of dollars in profits just in the first 9 months of 2022, yet was claiming they needed to charge the Lose family a $2,500 facility fee to pay their hospital staff. This is a national scandal. This committee has a responsibility to put the needs of our nation's families ahead of the greed of big healthcare corporations. I thank the committee for your time, and I look forward to answering any questions.